Pediatric physician and pediatrics department chair for Advantage Care Physicians. Thank you so much for being here with us, Doctor.
Thank you for having me. It's a pleasure.
And we are really happy you're here tonight, especially because we have been seeing and are seeing more and more of a really disturbing connection between COVID-19 and children that is proving to be deadly in some cases. Governor Andrew Cuomo today saying the Department of Health is now investigating about 100 cases for children or of children with symptoms similar to Kawasaki disease and specific symptoms that are coming out. What do we know, or what have you seen from patients or parents about this so far?
Well, yes, this is an increasing entity that we're seeing this past month with regards to children. You know, historically, we felt that children were being afflicted with COVID-19 at a much milder rate, much milder symptoms than adults were, until this past month when all of a sudden we saw an increase in these number of cases in which children were presenting with multi-system type disease characterized by high fevers lasting for several days, rashes leading to heart failure in some of the children with a diffuse what we call vasculitis, in which the immune system just goes completely awry, and it can cause symptoms such as red eyes, red swollen eyes, renal failure, kidney failure, and respiratory failure, as well as affecting the heart, causing heart failure. So this entity we're seeing somewhat more now. I don't know if we're just diagnosing it more because we are now a consciousness has been raised about this, but it is something of concern to the community.
Absolutely. I mean, just some of the things you just described, absolutely terrifying for parents. And after all of the stress that we've all endured, the trauma, you know, if you've lost a family member already, just the high stress of being scared to leave your home. I mean, we've kind of gone through so much over the past several months. But one of the things we didn't have to worry about, or thought we didn't have to worry about, was the kids in our communities and our families. So this is just such a, you know, a really serious development, but also a scary one too, to kind of add to the list. And from the numbers and the information that we're getting so far of these about 100 cases, you know, we did see 3 deaths so far. The ages were 5 years old, a boy from here in the Bronx, a 7-year-old boy, but then an 18-year-old girl. And we're seeing some cases up to 21 years old. I mean, that's crazy.
Yes. What's somewhat reassuring is that we know that this is still a very small number in comparison probably to the number of children who have been infected and contracted COVID. I think for the most part, the majority of children will improve. The symptoms will be mild. You'll have a certain percentage who will have mild symptoms with just fever, cough, just general malaise, body aches, which will resolve. Then those with moderate disease will have some degree of respiratory distress, shortness of breath, may require some respiratory support. And then you have that small percentage that can progress to this systemic disorder that we're seeing now.
Right. Okay, so again, just a lot to look out for, but now, you know, thankfully with people like you, especially coming on the show and us getting the information out there, we can all just be more aware and really just hope, you get to a doctor ASAP with this stuff. So we do have a lot of social media questions coming in too, definitely from parents as well. So I do want to get to our first question here from social media, and I know A is one of them, and she wrote, how does the virus affect newborn babies specifically?
Right. Okay, so in newborn babies, we have not seen transmission from mother to child, and I think we spoke about that in one of the previous episodes. We're not seeing what we call a vertical transmission. It doesn't seem that the virus is transmitted across the placenta into the fetus, so that babies who are born are testing negative initially for COVID-19. What can happen postnatally, though, after they are born, if the mother is positive for COVID-19, or if they are around people who are positive, they can become infected. And again, the symptoms would be very similar to what we see in adults and older children: cough, fever, shortness of breath. Those cases that have been hospitalized among children usually tends to be children who are less than 1 year of age, who do not have the systemic complications.
Got it. Okay, so more to look out for on that front. Let's get to another social media question too, definitely coming from a mother, it seems, who is writing, if different families all get tested and have negative results, can they get together?
They can get together, but you have to remember that there is an incubation period, if you will, that you can be negative today and positive tomorrow, as we saw from Vice President Pence's press secretary, who was negative one day before, and the next day she was positive, so that you can have an incubation period where the virus may not be detected. If family members get together, I think it should be along the same guidelines that we have, less than 10 people gathering at one time. Again, still wearing your facial mask, ensuring that you wash your hands frequently, that you have plenty of hand sanitizer around, not touching and hugging each other, and trying to maintain that social distance of the 6 feet.
Yes, that is the key. Thank you for that. Let's get to our first caller tonight. I know Renee is on the line from Bed-Stuy. Renee, how are you?
Hi, Renee.
Hi. How is everybody?
Hi, Renee.
Hope you and family fine?
We're doing good.
I have a question. In today's age, a lot of us grandparents are contributing to the family by raising or helping to take care of our grandchildren.
Yes.
With this disease catching on so quickly in the children, a lot of us have underlying health conditions. Is this something we should be concerned about for ourselves, not just our grandchildren?
Well, yes. You should always be concerned about your health and your grandchildren. Studies have not been done, but there is a question as to whether or not some children can be asymptomatic carriers of coronavirus. And no studies have been done, but we think that there may be that possibility. So grandparents who are caring for their grandkids, again, you have to ensure that the child is well, that there's no fever, there's no rash, there's no cough, and what have you. And you have to just be very, very careful. Again, right now, we're all isolating and quarantining. So the child should be in the house without any real exposure at this point to someone who is infected. Grandparents may want to wear a mask, and if the child is at the house, ensuring that you wash your hands, using, again, a lot of hand sanitizer. But again, just watching the child to ensure that the child is not showing symptoms of coronavirus, of COVID infection. And again, since children are now home, the exposure now tends to be somewhat less.
For sure. Yep. But Renee, thank you, because you're so right. So many people are in that position. We know that around our city. And if you're not taking care, we know multiple generations are all in the same apartment or the same home. So, we're at that point. It's been a long time that we've all been in our homes together. So I totally get that. Let's get to Karen, who's on the line in Tremont. Karen, how are you?
Good. I'm pretty good, but I have a good story.
Okay.
I want everybody to hear me out.
Okay.
Do you want me to tell you the story?
Do you have a question? Because we have about a minute or so left. So I want to get to the definite question. You know what I mean?
Okay. Hi, Doctor. I'm Karen from the Bronx.
Yes.
How are you this evening?
Hi, Karen. Hi, Karen. How are you?
So what's your question? Karen, listen through the phone, not the TV.
Doctor, I have a daughter that's 13 years old, Darcel. Good. How are you? I have a daughter, 13 years old. Her name is Darcel Mealy.
Okay.
Hello?
Yeah.
Yes, I can hear you.
Yes.
Karen?
Yes. Back in 2017, my daughter, my granddaughter Karen, my granddaughter Darcel, was diagnosed with Kawasaki disease. This was back in 2017.
Okay.
But the problem there was when the doctors were trying to find out what her problem was, they thought possibly it was some kind of a virus. Now, she had the virus exactly at...
Can I stop you right there? We have to get to this commercial, but when we come back, we're going to finish this up so the doctor can answer the question. We can get the rest of your info. Stay with us. We'll be back. Welcome to another coronavirus pandemic special report. We are joined tonight by Dr. Sheppard, who is a pediatrician and the chair of the pediatric department and Advantage Care physicians. And we do want to get to a question that we got cut off. We had to get to the commercial, but I do want to get to Karen and Tony, who have a joint question. It sounds like about your granddaughter, Tony. Can you ask the question?
Yes. Back in 2017, my granddaughter had a very high fever. We took her to Jacoby Hospital. They couldn't quite figure out what was causing the high fever. At that time, she showed all the symptoms of your corona-19. Now, when they finally diagnosed her, they diagnosed her as Kawasaki. But there was a young doctor there that thought that it wasn't Kawasaki. He thought it was some other kind of disease, and he treated her, and he got her fever down because she had a fever for like 10 days, and they couldn't get the fever down. So what we're thinking is that corona-19 and the Kawasaki are connected together because the exact same features that the kids are having today, my granddaughter had. And this was back in 2017 when there was no such thing as Kawasaki. But we're figuring that the Kawasaki either caused the corona or the corona caused the Kawasaki, because no doctors really knew about the corona-19 at that time, because who ever heard of corona-19 in 2017? But yet all the kids today have the same symptoms that my granddaughter had.
Yeah.
And it was
Right. Well, sir, you're absolutely. We did know about Kawasaki back in 2017, so that was an entity that we were seeing. What we're seeing now is a Kawasaki-like syndrome that's associated with corona-19. And when a child is diagnosed with Kawasaki, there's a complete workup looking for all sorts of viral infections that could be contributing to the symptoms that we're seeing. But right now, what we're seeing now with children who've been infected with coronavirus and developing COVID-19, or not developing symptoms at all, but later on they're testing positive for antibodies showing that they may have had a previous infection. So there is some relation there. There is research that's taking place now. It's an ever-evolving story, so of course we don't have all of the answers, but I think it's important that parents be aware of the signs and symptoms of this multi-system inflammatory syndrome, so that if you see that your child is running persistent fever for 3 to 5 days, has a very red, ruddy rash, is not feeling well, having vomiting and diarrhea, red eyes, swollen glands, please see your pediatrician or your primary care provider right away.
Definitely. And, you know, just as we've been saying from the beginning, that COVID-19, this specific coronavirus, is brand new. So we have been learning, and we are still learning, because here we are, you know, a couple months into this pandemic and learning how it might be creating these specific symptoms in some kids. So it's just another example of all of us, really, especially, you know, the medical community, learning more and more about COVID-19 specifically and what effects it has. So super interesting, though. Karen and Tony, thank you for calling in and bringing that up. And certainly Kawasaki and the symptoms of it are super serious. So thanks for calling in. Let's get to Kathy, who's over in Crown Heights. Kathy, what's your question? Oh, Kathy, can you hear us? Oh, hi. Yeah. Speak right into the phone. Yeah. How are you doing?
Okay.
Hi, Kathy.
I'm doing fine, thank you.
What is your question for the doctor?
Oh, my question is about my granddaughter. She has...
Hi.
Tell her what you have.
I have asthma.
And you want to know when you go back out to school. She wants to know, when she go back out to school, what would be the situation? So she has it very bad. She has to be on what? The nebulizer. She get neb treatment. She have what's that?
Two puffs.
The tube pop. And she we want to know, like, when she go back out to school, what will be the situation?
Right. Well, We don't have the answers yet to what will happen in September when children go back to school. We have multiple public health experts and infectious disease specialists, as well as healthcare professionals working on what type of environment children will be returning to when they go back to school. But certainly, if your granddaughter, Kathy, has chronic asthma, there are special accommodations that are made for children to ensure that they are safe while they're in the school environment, that their asthma is well controlled, and that is something that you would work out with your pediatrician, with your primary care provider, to ensure that her asthma is in good control when she goes back to school.
But Kathy, I love the fact that you called in. You're obviously living with your granddaughter, and the fact that she got on the phone and spoke about her asthma and, you know, is inquiring about how she should go about going back to school. I mean, I just love that. I don't know how old she is, but that's just super indicative of, you know, how curious she is and that she knows what's going on in the world. And so thank you for calling in, especially with her too. Let's get to another social media question here from Lala, who wrote, "My daughter and her husband had COVID-19. My granddaughter, though, never got it. Can we explain that?" And, you know, like we were saying, too, we don't know how obviously this is all affecting younger kids or just children in general. Might have been asymptomatic situation. I don't know.
There's a full spectrum from asymptomatic all the way to the multi-system inflammatory syndrome that we're seeing now.
Makes sense. Yeah. So again, we don't know what the situation is that Lala was writing in specifically about, but obviously they were exposed to those people who did test positive and have the virus. So again, we can all just be as careful as possible, especially when you're living with multiple people. But we're going to be right back. Stay with us. Thank you so much for being here with us tonight. We had a lot to go over, and we are so grateful to have Dr. Sheppard here with us to answer our viewers' questions who were calling in, especially regarding kids and COVID-19. But I know you had kind of some final words for parents out there who are watching.
Yes. At Advantage Care Physicians, we're made up of primary care and specialty care throughout all of New York City. There are 40 pediatricians available to help you and your children. A lot of people are not bringing their children in now for their vaccines because they're afraid that the offices may not be safe. We're taking all precautions to ensure that your children are able to receive their vaccines at the appointed time that the CDC recommends, especially children 2 and under. The last thing that we want to do is have an epidemic within an epidemic. So if our young children are not being vaccinated against diphtheria, whooping cough, tetanus, we could wind up with a whooping cough epidemic within this coronavirus pandemic. And if you all recall, last year when we had the measles outbreaks in various areas where immunization rates had dropped very low. So it's important that you speak to your primary care physician. We're available for you at Advantage Care Physicians to provide you with the information that you need and to provide the health care maintenance and vaccinations and immunizations that your child needs. Thank you for having me today, Jessica.
Oh, thank you so much. This is just, you know, again, another way that we're trying to help our viewers. And of course, as you just trying to get the message across and get the information out there to as many people as possible. We are grateful for that. I'm sure we're going to have you back again. And we are going to be back here tomorrow night at 7 o'clock. So join us then.